Welcome to NHI Grad Night, Paws-On for therapists, an introduction to canine massage for massage therapists. I'm Chip Simplensky. I went to school here at NHI, and I have since become a small animal massage therapist. I'm a reader, and I think one of the best ways to learn a little bit about somebody is to kind of look in their library and see what they've been reading. One of my books that I go to quite a bit is Dog Steps. It actually reviews gait analysis for quadrupeds. Additionally, What's Your Angle allows you to look at conformation, or essentially posture, for dogs. Miller's Anatomy of the Dog is essentially the Gray's Anatomy combined with Netter's work to provide a pretty good insight on the dog. One of my favorite approaches to working with dogs is T-Touch, which you're going to learn about a bit tonight, by Linda Tellington Jones. It's important to be able to understand how to communicate with dogs, and particularly the calming signals that Turrid Rugas has put out. Always have potent points available there. I was looking at Miller's before I bought it. It's not an inexpensive book. Athletic Body and Balance by Gray Cook. Thomas Hanna's Somatics. Move Like a Human. Really inexpensive, but I really like that book. Of course, Timothy Ferris's The 4-Hour Work Week. Natural Born Heroes, Christopher McDougall, is one of my favorite. If you ever want a great read that combines some really interesting history with really great strength and endurance secrets, that's the book to get. One of my favorite Feldenkrais guys is Alphonse. He's got a great YouTube channel. Chi Walking and Chi Running, something that I like pursuing. Newborn Movement Assessment. It's great to understand how we should move by studying the really young. The Cool Impossible by Eric Orton, which is another great training book on how to run. Born to Walk by James Earls, kind of the human analog of Dog Steps. Todd Hargrove's Better Movement. I like his work, studying for the MBLEX. Pavel's Simple and Sinister Kettlebells. I've been a follower of Pavel for coming on close to 20 years now. Gray Cook's FMS. You've Got to Live Like the Lebowski, the Abide Guide. Why Zebras Don't Get Ulcers by Sapolsky. If you want to understand the nervous system, this is a great place to go. Of course, Explain Pain by Butler Mosley. A great book. Use that with clients quite a bit. Anatomy Trains, a great place to start understanding fascia and how to get the most out of your body, which ties all the way back to book. Ties all the way back to Natural Born Heroes. That's how those guys kind of made it happen in World War II. So fascia is a big thing. Neurokinetic therapy, chi healing powers. Interesting how they use acupressure in self-defense. Some qigong, self-massage, acupuncture point locations. Great story about Linus Torvalds and Linux, Time of Nero, who'd really discovered metabolic typing, mindful eating. A great book about relationships, The 7 Principles. I liked the idea of a Muslim writing about Jesus, so I kind of read that. Of course, Game of Thrones, the dude Dai Chang. If you really are into Taoist thought, the dude is the best place to learn that. Jeff Brizich is the dude in the Zen Master. Inside the Hidden World of the Tour de France, Signal and the Noise by Nate Silver, and of course Gulliver's Travels. Hope that gives you a little bit of insight as to what you're going to be dealing with here in the next couple of hours. This is my presentation partner, Buster, and we'll be taking you through 2 nights of lectures and hands-on work. The first night tonight is a lecture, and we're going to have Paws-On humans. We're actually been working on each other. We'll cover small animal massage education, the human versus canine massage, differences and similarities, T-Touch, which is a way of working with animals, an introduction to that and a practice on humans. We'll come back in February for Paws-On dogs, where Canine Companions for Independence, or CCI, will be providing puppies, and we'll practice our T-Touch on puppies and the puppy raisers. Please keep in mind that these sessions are no substitution for veterinary medicine. Don't think just because you've taken this class that you can deal with problematic animals. You have just enough skills when you're done here to start working with your own dog or with a well-trained dog like the ones from CCI. If you are interested, a large portion of this presentation is going to be talking about different schools, what you learn, and how you can apply that. There are several associations that help guide the industry. I have my insurance through the International Association of Animal Massage and Bodywork, which works with the AMBP, or ABMP. The MBCAAM is a certification body for acupressure and massage, and the American Council of Animal Naturopathy is another organization that gets involved with animal massage. There are a handful of certified schools. I chose to go to the Ojai School of Canine Massage. It's a 200-hour online course. It costs a little under $2,000 by the time you're all done. Their home base is in Ojai, California, but typically Nikki Scott, one of the co-owners, and the primary instructor, is traveling worldwide. He was in Thailand for the bulk of my work. He's a very experienced body worker, and just getting to know and talk with Nikki is a great experience in and of itself. The other big school I looked at was the Northwest School of Animal Massage. It's structured much more formally. I might even equate it to like the NHI of animal massage. And a comparable program for them would have been about 300 hours of online work and taking a 5-day practical. It's about $2,500, and then you need to buy your books, which would probably be about another $500. They also offer other advanced programs, and there are a lot of other programs that you can take involving water therapy, etc. The curriculum at most of these schools is very similar. Anatomy and physiology, pathology, mostly covering the common things, and particularly contraindications, behavior, Gait and conformation is huge because that's one of the largest ways that you assess an animal, is seeing how they move, and essentially they're evaluating their posture. The class was really big on traditional Chinese veterinary medicine, much more so than anything I received at NHI. It was quite challenging, actually. A lot on acupressure, tuina, which is the traditional Chinese medicine form of massage. And then a lot of the same basic Swedish trigger point, myofascial stretching. We did also cover quite a bit of T-touch, which we're going to talk about much more tonight. And optionally, he threw in a big nutrition section, which was quite good. And the business section was, I enjoyed it. It was pretty robust also. So as Buster's letting us know, canines are significantly different than we are. Anatomy, behavior, communication. The fact that they're a four-legged animal, their posture and movement is significantly different than ours. They do have fur and a tail, which is a huge difference also. Dogs as a species are the widest ranging size of any species that's defined, basically ranging from little teacup animals to full-size wolfhounds. Their social interaction is quite complex and quite different than ours. They have some of the same emotions, but express them in significantly different ways. The skills that they both possess and respect are a little bit different. The way they sense and the way they are motivated is significantly different than we are. And of course, they have different attention spans. There's a lot more that is different, and I certainly would invite you to raise your hand and let us know what you think might be different that I might have missed. Now, the nice part about the differences that the dogs do have is that they're not so different that you won't be using essentially the same tools. You're probably going to be using them in slightly different ways. When you greet a dog, you do want to have a friendly, confident, initial approach, and we'll talk quite a bit more about that later. You're going to assess, just like you would any other client, using intake forms, behavior, conformation, gait, and other cues to help you direct your touch. The communication that you have is primarily without words. You'll be using touch, posture, sounds. You may use your words, but they'll have absolutely no meaning to the dog. Same basic massage modalities, similar but slightly different bony landmarks. Again, it's so huge that these guys have fur, they have a tail. They use their mouths much more than we do, so we'll focus quite a bit on the mouth. They have the capability to move their ears. We just don't move our ears very often, so they love ear work. So a lot of the same tools used in different ways. Those of you who know me know that I love anatomy and kinesiology, and this was a really interesting experience because the references are so different. There's no such thing as an anterior and posterior aspect to the dog. You really need to talk about ventral and dorsal to have anything that's meaningful. Likewise, superior and inferior is kind of confusing with a four-legged animal. And so the tendency is to use cranial and caudal. So we'll use the serratus anterior muscle as an example. It is referred to as serratus ventralis. Serratus posterior superior would be serratus dorsalis cranialis, and serratus posterior inferior would be serratus dorsalis caudalis. Caudalis meaning towards the tail, cranialis towards the head, ventralis towards the sternum, dorsalis being towards the spine. Another interesting aspect is arm and leg. So there's about 3 or 4 different references. An arm would be the cranial limb, the thoracic limb, or the forelimb, whereas the leg would be the caudal limb, the pelvic limb, or the hind limb. We're going to run into some other differences, but I wanted to really kind of make you aware of that some of the terminology just switches up just enough that it's easy to get confused. So it's interesting, the names of a lot of things are quite different than you might be used to using. As an example, the space between the shoulder blades is known as the withers. And so you might hear the term down in the withers, which actually means that the serratus muscle is a little weak and the scapula actually rides above the spine itself, the spinous processes in that area. The croup is essentially the sacrum. The stifle is the knee. The hock is the ankle. The pastern is the wrist. That flap of skin that covers the mouth is known as the flu. And the more vertical aspect of the nose leading into the cranium is referred to as the stop. So there's just some slightly different naming conventions, many of which came from horses, that you just need to be aware of and adapt to. So if you love fascia like I do, you're really gonna really like working with dogs. It is fascinating that they have a muscle called the cutaneous trunci muscle, which is used to move a large portion of their fascia. Additionally, they do share with us the platysma muscle. They also have a sphincter muscle of the neck that is used to move fascia. Fascia is a big deal with dogs. In my opinion, dogs are much more fascially aware than humans, and of their fascia, and their fascia is generally healthier. As an example, how often do you move your ears? Really don't want to spend too much time on a lot of the anatomy, but there are some things I'd love to point out just so we know that there are big differences here. First off, dogs don't have a clavicle, but they do have a clavicular tendon, and we'll take a look at that here in a second. Dogs have 7 carpals, they have 7 tarsals, but what's interesting when you really look at them is that they're essentially standing on their fingers and toes. Their metatarsals are nowhere near the ground, and certainly their carpals and tarsals aren't touching the ground. So quite a bit of things to explore here. I think one of the most fascinating differences between canines and ourselves is in the spine itself. For the most part, they keep pretty much a kyphotic curve throughout. Their cervical curve is a pretty extreme lordosis, lower lordosis with an upper kyphosis. They do have 13 ribs rather than 12. They have 7 lumbar vertebrae, so they're a little bit longer there. Their sacrums in general are just a little bit shorter. They're about 3 vertebrae. Of course, one of the largest differences that we would note is that dogs do have a tail, generally 20 to 23 mobile coccygeal vertebrae. They have many more intervertebral discs, and they do suffer from intervertebral disc disease just like we do. Their primary loading is a dorsal force pushing them ventral, whereas our primary loading is a vertical force pushing superior to inferior in our normal orientation. If you study these muscle diagrams of the canine briefly, with the more superficial muscles to the left, the deeper muscles to the right, you'll probably see some names that are very obvious to you, shared with humans. You're also going to see some names that you don't recognize. We talked a little bit about the cutaneous trunci, which actually moves fascia. Sternocephalicus, brachiocephalicus are muscles that actually run from where they're named, from the sternum to the head, and from the arm to the head. The interesting thing about the brachiocephalicus is that the clavicular tendon actually sits between two portions of it, the cleidocervical and the cleidobrachial slibs. There's a few other muscles in here that you may not find very familiar. We're going to get in a little bit more about the anatomy in just a second. It's important to keep in mind that even if you do recognize the name of the muscle, the anatomy may be slightly different. As an example, looking here at the thoracic upper limb details, the deltoid is really only a two-part muscle on the dog. On the human, we have a clavicular, an acromial, and a scapular component, which map to the anterior, middle, and posterior aspects of the deltoid. On the dog, he really only has two parts, the scapular and acromial aspects. So you're probably wondering at this point, how do we know what to work on? Well, the good news is that for our T-Touch work, we're really not going to worry too much about this. We're going to mostly be working with healthy animals, and we're going to be working, T-Touch is primarily targeted at working with the nervous system. So we're not going to be too concerned about this. But for an animal that I might be working with that has issues, of course, the first thing we do is we pretty much following the Hopper's idea: history, observation, palpation, range of motion, and special tests. When we take our history, remember that everything is secondhand. So there's a whole interpretation using the biopsychosocial model for both the caretaker and the animal itself, when you're kind of looking at that history. So it's even more complicated than a human, in my estimation, since you can't actually query the patient or the client. Observation comes down to really conformance and gait. We're going to talk a little bit more about conformance. Conformance is essentially posture, but there are some complications because we have a four-legged animal. Palpation is pretty much as you would expect. For range of motion, it's primarily passive range of motion. Most dogs do not know the command abduct your glenohumeral joint. You can get creative for active range of motion and manual resistive range of motion. Putting peanut butter on body parts can get a dog to attempt to do a move or actually accomplish the move that you're looking to evaluate. Treats work, watching them play with toys. There are some tricks there. Special tests. It gets complicated here. Some are virtually identical, the drawer test, Tennell's test, etc. Some are impossible and not even applicable. The empty can, as an example, or failings. You're just not going to get a dog to go into those positions. So you'd kind of have to evaluate each of those on their own merits. I'm in 100% agreements with Buster here. I hate conformance. So the idea is you've got this dog with 4 legs, and they can really adapt to quite a different ways to weight their bodies between those limbs. To do an evaluation of, quote, posture, you really need a standard way for the dog to align himself. Most dogs have not been trained to do this. Show dogs do it all the time. The basic alignment is that the front leg is vertical and the rear metatarsals are vertical. So as you can see in this picture of Isabella, that she is lined up. Those 2 green lines show that she's lined up pretty well. It takes a lot of time to get a dog that isn't trained to do this, to do it right. Even here, the camera is probably a little off. We should be, so that her limbs actually line up as you look through, would allow a better analysis. You then put some marks. You're really looking at the top of the scapula, the point of the shoulder, the olecranon process that pretty much takes care of that front red angle. You then look at the iliac crest, the base of the tail, the ischium, the stifle, and the hock. So if you look at the iliac crest, the ischium, and the stifle, that's that second red triangle. And that starts to really set the major angles. The other big thing that you would be looking at is, as we go from that iliac crest to the base of the tail, we're essentially looking at how her pelvis, or excuse me, how her sacrum is oriented. And the length of the sacrum and the angle of the sacrum starts to drive some real fundamental mechanics in locomotion. This stuff is all great. Unfortunately, the ideals are very breed specific, sport specific, and task dependent. So looking at your little dog that's sitting on the couch versus a Rottweiler versus a Greyhound, which are really all bred to do different things, you're going to see significantly different angles. And knowing which is better for what is the subject of many barroom discussions among dog aficionados. I tend to use gait more for my analysis. I'm not particularly adept at it yet. I need to use video analysis. I use tools like Coach's Eye or Technique applications. It's quite complicated. Quadruped gaits, there's a walk, an amble, a pace, a trot, hackney trot, a flying trot, a canter, a transverse gallop, a rotary gallop. Great little website. I'm going to show you a little clip from here that goes over these gaits and what they look like. There are so many faults, and the arcane technology or terminology used with this is amazing. Sickle hocks, padding, pacing to avoid interference, roaching, knuckling, sway back, high croup, flat withers, not moving in the same plane, crabbing, crossing. It goes on and on. A lot of it came from the horse culture, but we'll go over some of that here in a bit too. I really like this tool here for looking at gait analysis. It's online, it's free. You can look at this. This is the normal walking pattern of a canine, or of any quadruped actually, showing the slow motion view. You can also individually go through the steps. So we'll step forward from here, and you can see on the right is the legend for how to interpret which of these paws are in which portion of the gait cycle. And that completes a walk. You can do that same for the amble, the trot, the pace, or the canter. Additionally, you can look at what a gallop looks like. Hi, Sue and Michelle. Want to kind of get your opinion on what you see, if you see the same thing I see here with Nisa. She tends to have, keeps this left nice and straight, and what you're going to see is that the right is going to angle in just a bit when she plants. So if we go to green here, it's coming in a little bit more like that. We've got a nice straight plant there. A little bit more of an angle there. Back to a nice straight plant there. I think this angle's a little bit less. Oops. Little bit less, but you can kind of see this pattern that has emerged. Here's a little sample of some of the terms that are used to describe gait or conformation. Camelback is an arched back or spine. Chippendale is the same as a fiddle front. If we come on down here, a fiddle front is the elbows lateral, forearm slopes medial, and the pastern or paws directed lateral, causing excessive medial carpus strain. As you can see, these a lot of these are derived from horse people in terms of the names. Some of them are pretty obvious, and some of them are not so obvious. Rabbit paw is the same as a hare foot, which is digits 3 and 4 are considerably longer than digits 2 and 5. Moderately arched foot with an elongated oval print. So this gets pretty involved pretty quickly. I had to create this sheet for myself just to keep things straight. We'll rather quickly now kind of go through some of the modalities that you can use on your canine. Swedish definitely is a great technique. Basic strokes, friction, effleurage, dépotement, petrissage, and vibration or shaking. Additionally, through in stretching there. The acupressure or shiatsu or traditional Chinese medicine is quite developed for the dog. There's actually certifications in these specific techniques. Obviously, one of the interesting parts is your trend measurement needs to scale with the dog. The chart in the lower left shows that. And just as an example, here's a layout of the urinary bladder and kidney meridians for the dog. Tuina is a beautiful set of manipulations associated with traditional Chinese medicine massage. It consists of swinging, friction, squeezing, trembling, percussing, and various subdivisions of each of those. Additionally, there are some special manipulations. You've got to love the term wrenching when it comes to working with anybody. Most of these you've probably done. There's a few you probably haven't, including hopefully wrenching. And the one of the more interesting ones, in my estimation, is gunfa, the rolling of the hand across the body. It's an interesting technique if you've ever seen it. One of the papers I wrote was on adapting archers' lymphatic facilitation for use on the canine. There was a fantastic paper I ran across, lymphatic territories in a canine, an animal model for investigation of post-operative lymphatic alterations. One of the interesting revelations from that is the dog may be much more studied than the human because people feel they can do so much more to dogs in the name of research. And so there is quite a bit of information on dog lymphatic systems because they're so similar to ours. They use them to look at, well, what happens if we do a surgery here? How does the lymphatic system adapt? So you can do, as you see, the canine respiratory pump. I came up with 3 different ways of doing that that are interesting. This is the most similar to our classic respiratory pump that we learn in class. Stationary circles are pretty much the same. But you can see the essentially watersheds of the lymphatic drainage are very, very similar to ours. They have the same asymmetric nature between the right and left sides. They have a cisterna chyli, and very, very similar to our systems. Buster really does love myofascial and trigger point work. You can see him there receiving intraoral pterygoid and masseter release. Very open to passive range of motion testing, and he just loves deep transverse friction. He has no clue what to do with PNF stretches, and neither do I when working with him. And a number from 1 to 10, he doesn't even know what a number is. The way he will communicate that this pressure is on the border is he will actually look back to your hands. If you've hit a trigger point, he'll kind of perk up and look over and kind of give you this questioning, hey, what's going on there? And if you're smart with a dog the size of Buster, you'll back off a little bit till he goes back to his more passive posture. So the bottom line here is what you need to do is improvise, adapt, and overcome. You have all the tools you likely need to be successful. You're going to use your same energy work, your fascial work, muscular, neurological, and lymphatic techniques all adapt. In the maybe category, I put hot stones and cold stones. People do, pursue that. I don't think I would. It's difficult to get the feedback. These animals will take an incredible amount of pain before they kind of revolt. So I just wouldn't feel comfortable doing it. In the probably not category or the are you crazy, I would not attempt scrubs, wraps, oils, or lotions. There are probably people out there that do that. I'm not aware of them, but the ultimate limit here is how well do you communicate with a particular pet, and do you feel that you could do it and that they would benefit from the work? It's important to follow some real basic safety rules. If you have a dog that indicates it doesn't want to be touched, either avoid that area where it doesn't want to be touched, or just get up and leave that dog to, today's not the right day to work with him. Don't let a dog jump on you. Don't put your face by a dog or let it lick you. It's probably been licking places you really don't want on your face, and there are diseases that transfer from animals to humans called zoonoses. Don't be fooled by a submissive dog luring you in to get bit. You really need to look at multiple signs. We're going to go over what some of those signs are. But trying to use a tail wag or a I'm rolling over, rub my belly as a sign of, oh, it's okay to move in, can result in a bite. Don't be aggressive or play aggressively. This is serious business. Playtime is another time. This is time to work with the dog in a very different way. So if you're like me, you probably know exactly how to approach a dog, but sometimes it's really tough to avoid some of the pitfalls here. You really don't want to lean over the dog ever. You don't want to grab or hug him. You don't want to stare him in the eye. That can be a problem. The high-pitched squealing is generally not what you want, particularly when you're about to massage a dog. And grabbing and kissing, definitely out of the question. So the basic idea is when you go to greet an owner with the dog is no touch, no talk, no eye contact with the dog. Approach the human, have a discussion with them. Let the dog come to you, and then you're going to come down on its side. At its side, and then you can start engaging with the dog. I forgot to mention on the previous slide, these little drawings showing the signals and the how to greet a dog come from a really, really nice source, doggydrawings.net, free posters by a woman named Lily. I forget her last name, but she does a really nice job. The dog's name is Boogie. That's her Boston Terrier. And we'll go through some of these signals here. Most of these are calming signals. An alert dog is, that's you'd kind of like a nice alert dog of engaging with you. Scared dog, that's not so good. You're going to need to work on that, probably come in from the side and let it get used to you. Some of the real calming signals are the raising the paw, the turning the head away. That's a good sign. Trying to make that dog is trying to make peace with you. Licking their nose, blinking their eyes are other signs. Yawning, turning his back to you, sniffing the ground. When dogs meet each other, they like to go in a curve around each other. Going straight line to an animal actually is quite threatening to it. The play bow is a classic. I'm ready to work with you. Submission, rolling over on their back, on their side. The only, again, be careful with this one. A lot of dogs will lure you in with that and bite you. So look for multiple signs there. The ears flat with a round face, kind of, I'm a harmless puppy kind of look. The interesting thing about these signs is that you can use them to help calm the dog down, that you're there to bring peace and calm. As an example, yawning or blinking your eyes are two things that you can do that the dog will likely respond to. The play bow, getting down low, turning your side to them, turning your back to them. These are all things that communicate to them that you're willing to try to calm them down. A couple of quick summaries of do's and don'ts before our first break. Judicious treat usage. You might want to ask the caretaker if you can use treats, but treats are a great way to work with the dog, get it to perhaps get in a position that you'd like it to get into. You want to provide a calm and safe environment, and to do this, you are going to have to be super adaptable. The one thing I can say is that for me, working with dogs is more physically demanding than anything I've done working with humans. It makes shiatsu look like a walk in the park in terms of things you're going to have to do to get into the right position to do what you want to do. Initially, you're going to do this work with the caretaker present. Sometimes the caretaker is more disruptive than if they were gone, and so you might ask them to leave. And eventually you'll work to the point where both the caretaker and you trust you being alone with the dog. Let the dog choose their position and or move. It's not like someone that's come in to work with you in a spa or a clinic. They are going to need a little time to adapt to what's happening. In general, once you have made that connection, they're more than willing to cooperate with you. But it's a lot like any other massage. The client is in control. Recognize and respect the dog's limits. And this can be tough to really figure out, regarding duration. When he gets up and walks around, is he really done? Or are we just taking a break? Intensity is a little bit easier to figure out. If he turns his head and looks at you, if you get a growl, that's pretty obvious. Range of motion is another one where if he starts pulling away, if he starts resisting, stop there. Obviously, any indication of pain, you stop. It's much like working with any of our clients. You really want to send off calming, not threatening signals. So let's go over some of those calming or cutoff signals. The original literature was cutoff signals. There are about 30 of them. Some of them are so subtle as I doubt that we could effectively use them in a clinical environment. As soon as they, head turned to his side, eyes to the side, almost ignoring them to say, I deem you safe, I don't want any trouble, is a great way to go. You're probably not going to lick your nose, but you can licking if they see your tongue go in and out. Freezing, just if you freeze, that's one of the best things you can do to de-escalate an escalating situation. From there, move slowly. One of the great things that works there is blinking the eyes. They'll pick up on blinking the eyes. They know that, okay, this guy's not out to hurt me. Play bows, being down, laying down. Yawning is another interesting one that you can do even if you're frozen. Heavy breathing, heavy sighs. Sniffing. You can do the Donald Trump sniffing thing and calm the animals around you. Best to move in a curve on approach. You'll notice that most dogs will do that when they come to you. Splitting. If you get someone that's familiar with the dog between you and the threat, that can actually really help in de-escalation. Making yourself as small as possible. You don't want to be licking their face, but blinking eyes, smacking lips, lifting your arms in a non-threatening manner, in a passive manner, can also be interpreted by them as a sign of, hey, this person wants to make peace. Be calm. Now for the big don'ts. Don't overstimulate the dog or put it in an environment that's overstimulating. You never want to force a dog to do anything. That's not a very good way to build a relationship. Don't get distracted. If you miss just a couple of cues from a dog, that could be a trip to the emergency room. You want to really be focused on the dog. You cannot get too excited talking to owners or people. You need to make sure that you're paying attention to that dog. Some of the threatening or excitement signals, and they'll do them to you, or you can do them do it to them and get them excited. Staring is considered impolite in the canine world. Walking straight to an animal, that's not, it's considered a little threatening. Standing over the animal, baring teeth, growling, barking, literally attacking, those are all excitement things that as soon as you see any sign of these, you want to de-escalate with some of the calming signals. I know I went through that first section very fast. There's a lot of great stuff to go through there, but from my point of view, I think you're going to really enjoy the hands-on. I want to get you as much hands-on as possible. If there are any questions about that first half, now would be a great time to do it, or if you'd rather talk to me during the break, feel free to do that. Welcome back from break. Buster has a little homework request for you all. I'd really like to see you purchase these cards, like I have right here. They're the T-Touch Magic Cards for dogs and cats. They're kind of a reference for some of the material we're going to be going over. They're like $9 to get a physical copy, or $7 for an instant PDF download. I recommend getting the book also. You're going to find out a little bit more about Linda Tellington-Jones here in just a little bit. And amazing woman with an amazing approach to working with animals. So Linda Tellington-Jones came from a long line of horse people. Her grandfather was actually doing horse massage for the Tsar right at the turn of the century, the 1800s to 1900s. She brought that horse massage to horses, and in 1965 published a book on equine physical therapy. In 1975, she went to go study somatics with Moshe Feldenkrais, one of my heroes. And she intended to help riders with this skill, but kind of in the middle of this course, she had an epiphany of, well, but what about the animals? One of Feldenkrais's statements is that the potential for learning could be enhanced and learning time shortened with the use of non-habitual movements. And that was essentially the genesis of her playground for higher learning, which we'll learn a bit more about later, but it's essentially obstacle courses for animals. And so it actually started with movement, which I like. Later, around 1983, while working with a particularly obstinate animal, her intuition kind of drove her, and her intention, and she started touching the animal and got a great response from it, and that was the genesis of the T-Touch circles. She's really focused on a cellular level change, literally at the neuron level, very much limbic system focused, which is very similar to a lot of the energy work, dermoneuromodulation, those sorts of approaches. One of her kind of mantras when she's working with an animal is to remember that its potential for perfect function is always there, and remember that perfection. Remind it that it can do what it needs to do. So T-Touch is really a lot more than just its parts. We're just going to focus on the touch part of it in this class. But it really also incorporates, it's almost a philosophy that you're incorporating here. The playground for higher learning, which is essentially these obstacle courses, all types of equipment wands and leashes and halters and wraps to kind of help, in many cases, boost the confidence, reduce the fear in an animal as you expose it to different stimuli and try to get it to become more in balance, basically. I kind of think of T-Touch as dermoneuromodulation meets Reiki, and they explore Feldenkrais to add movement, but they just end up petting puppies. There's a lot of marketing going on here when you go to visit Linda's site, but seriously consider these techniques for your human clients also. There's a lot to be said here. There's a lot more, although she developed it with a lot of intuition. If you look at a lot of the science coming out today, it just backs up what she was doing, what Feldenkrais was doing, what Hannah's doing, etc. So the other aspects of the touch portion of T-Touch, such as glides, slides, and lifts, they pretty much, you hear the name, you know what to do. The T-Touch circle mechanics can be slightly more involved, but still pretty straightforward and natural. You're basically going to engage the skin very lightly in most cases and move at about 1 1/4 circles. So if you look at the clock, if you start at 6, you're going to go up. If we're going to go clockwise, we're going to go up to 12, to 3, back around 6, and back to 9. If you're going clockwise, we're going to go 6 to 12 to 9 to 6, back to 3. You can go clockwise or counterclockwise, whatever is most comfortable for you and whatever the dog responds to. The pressure scale is 1 to 10, but in general, you only work 1 to 4. So a pressure of 1 just moves the skin under or on the eye. Just moves it. Pressure of 3 moves the skin on the cheekbone, or is about as much pressure as you would want to put on your eye to move the skin. The tempo is 1 to 3 seconds around that circle. The faster you go, you stimulate. The slower you go, you calm. You want to take some occasional pauses between strokes. You can connect the circles with light contact, but you want to lift over any painful or sensitive areas. The dog really chooses the position. It's likely going to move. You want to support the dog. If you're working on the muzzle, a hand underneath is very nice. If you're working on the ears, a hand underneath the ear and a hand over works very nicely. You want to pay attention to your breathing. This is one of our calming signals. It's probably our largest calming signal with every client we work with, is to be mindful of our own breathing. Holding a positive intention is a large part of this. And you want to look for those signals and respect them. Be aware of how the dog is reacting. And follow your intuition. Adapt. This is a very, very intuitive approach to body work. Buster and I are aligned again. I also love the names of these T-touches. Touches are typically designated by an animal name or the part of the animal that defines the stroke. The primary definition of what you're doing is what type of stroke it is. Is it a circle, a slide, a glide, a lift? The hand contact, what portion of the hand makes contact, and the pressure applied. Now, these touches have different uses, and the same touch can have different uses with different pressures. So you may use one touch for a aggressive animal, and with a different pressure, you may use that same touch for a frightened animal. It all just kind of depends on the circumstances. So now the fun begins. The rest of the class is pure play. I'll show you a couple of T-touches, Noah's March and Clouded Leopard. Then I want you to pick a partner, and you guys can trade partners. It's up to you guys. However the class dynamically organizes itself is fine by me. And you're going to practice these touches, Noah's March and Clouded Leopard. Then I'm going to ask you to come on up and take one of these sheets. These sheets describe each of the touches you see on the page here. Try it with your partner, both of you. Then return and grab another sheet and keep going. You should probably stay away from the tail and mouth touch on your human partners. Unless your partner happens to have a tail, in which case you're fortunate. Definitely do tail touch with your canine, though. It's probably one of the more powerful touches you can do. The big advice I can give you at this point is to relax. Remember to ground in. Stay focused. Breathe. And have fun. Follow your intuition and call me over if you have any issues or questions. This image is a T-touch card explaining Noah's March. Noah's March is essentially an effleurage-like stroke that you use at the beginning of a session and at the end of the session. At the beginning of the session, essentially, you're preparing the dog, palpating, feeling where's the tension, where are there issues, where's the dog sensitive. At the end of the session, what you're really looking to do is to integrate all those previous touches, get the dog more aware of its total body. The next card we're looking at is the Clouded Leopard card. This is a slightly more sophisticated touch, so there's a little more information on the page. You'll note that the hand shows just the tips of the fingers contacting the animal. You'll be doing that circular motion, either clockwise or counterclockwise, for about 1.25 rounds around the circle. Additionally, you'll see a section that talks about the uses and the pressure during those uses for various issues that you might be addressing with this touch. What I'd like to do at this time is actually ask for a volunteer, and I'll kind of show you these touches on a human, and then we'll break off and start practicing. Okay, so we're getting ready to wrap up here. I really thank you all for coming. This was a great session. I hope you all enjoyed it. Buster's homework request still stands. Hopefully the work we just did has inspired you to spend the $7 to get this information for you to practice with your own pet and to get ready for our upcoming session. So you can go to www.ttouch.com. In the shopping, this link is valid, product ID 134. In terms of what you're looking for is the magic cards for dogs and cats. You might be able to get it cheaper on Amazon, I don't know. I recommend getting the book also. It's a wonderful book. Tells the story I kind of related to you in much more detail. Gives plenty of examples of different people that have used T-touch, from veterinarians to dog trainers to dog owners. And it's just a wonderful approach to working with animals. See you guys next session.